Good morning. This is a very common question I get asked by my cancer patients most of the time. Doctor, what would happen to my body if I walked 30 minutes a day for 30 days? No gym, no running, no complicated workout, just walking. So, scientifically speaking, the changes may be more significant than you really think, and some benefits can begin after your very first walk. So let's go through what happens inside your body. After your first walk, within minutes of starting to walk, your muscles need more energy. Your heart begins pumping faster, your blood flow increases, your muscles begin to use the fatty acids and the glucose that's been sitting there as fuel, and your blood vessels respond to increased blood flow by improving the ability to dilate, which is amazing. Uh, Interestingly, one single session of moderate physical activity can temporarily lower blood pressure, reduce feeling of anxiety, and improve sleep quality. And so, walking doesn't need really to be a 1 month ordeal before you start seeing the difference, because truly your body responds immediately. Um, During the first week, what I have seen happen in most of my patients that do actually listen, uh, their muscles repeatedly become better at taking glucose out of your bloodstream and using them. This matters because regular aerobic exercises improves insulin sensitivity, and in simple terms, insulin can do its job more efficiently. Your cells become better at responding to insulin, and your pancreas starts producing insulin more effectively, and that overall improves your blood sugar control. And particularly people who have insulin resistance, which is what we hear often as what in some instances we call fatty liver disease, you start noticing the benefit of that very quickly. So uh, I try to tell my patients start walking as soon as I literally write a prescription quite often. And it's 30 minutes a day for 30 days. And this will train your heart, it'll train your muscles, it'll train your bones. As your muscles get stronger, they can protect your bones, especially in my field where cancer goes to the bone quite often. By week two, generally speaking, walking is a lot easier. You're less tired, you're more comfortable. You probably bought a new pair of shoes, and now this is something that is more meaningful to you, especially when you start realizing that your blood pressure is now lower. So, the one analysis that impressed me, just reading up on it, was that uh, there was reduction in systolic blood pressure, roughly 3 to 4 millimeters of mercury, and this was in middle-aged and older patients or people, compared to people who did not participate in a walking program. That may sound small, but if you thought about it from a cardiovascular health, that is super duper important. The next part where the benefit kicks in is your brain, mainly because it affects your mood, your stress, your cognition, and your sleep. The report I read from CDC basically says that physical activity can reduce short term feeling of anxiety, improve sleep, and over the long term, it reduces the risk of depression and what we all deal with, anxiety. And so there's something very important about walking, and it's sustainable. You don't need a gym, you don't have to be an athlete, you don't need expensive equipment, you just need to move. So, generally speaking, after my patients see me by day 30, uh, I tell them, guess what? You walked 15 hours this month. They're like, oh, I did? Well, yeah, 30 minutes a day, not a whole lot of math there. And your blood pressure got better. Your endurance got better. Apparently, you're sleeping better. You're not asking me about anxiety and uh, the things that you used to ask me. And depending on your diet, the walking speed, your body size, and how much fat you have to lose, I've really never had a patient who took that prescription of 30 minutes for 30 days and didn't do it and wasn't happier after they saw me. So, uh, do not judge your success with your walking by looking at the scale because that's not the key. Uh, it's really the metabolic cardiovascular benefit and the brain benefit and the spiritual, mental, psychological benefit you get. How fast should you walk? If you can do brisk walk, it's a lot better. Uh, you should be breathing harder than normal. Uh, it'd be nice to be able to carry a conversation as you're doing it. 30 minutes of moderate activity really will give you a very decent uh, target of aerobic health based on American Heart Association. And if you were to do that for, a long time, then you be ahead of the game in every sense. You can fight your cancer better, protect your bones better, etc., etc. So 30 days is not the end of the story. 30 minutes is not the end of the story. But the strongest evidence truly comes from long term habit. Regular walking is associated with better cardiovascular and metabolic health, and it contributes to healthier aging. So think about walking differently. It's a prescription that I'm writing you. And don't think of it as, oh, it's punishment. No, it's not. Don't look at it as you're losing weight. It's not. Think of it as you're doing something for your heart, for your blood vessels, for your muscles, for your blood sugar, for your brain, for your sleep, and your future health. 30 minutes once a day for 30 days, anybody can do it. And I promise you, once you do it, you will not stop. This is probably the best advice I can give you, and I hope you take it to heart and you start doing this today. This is Dr. Alex Eson. As always, this is what I share with my patients every day, and I'm trying to share it with everybody who needs to hear it. Have a wonderful day.